Good afternoon. My name is Vanessa Serrano, and I would like to thank the Board of Committee for giving me the opportunity to testify before you today. I represent the National Association of Social Workers, and I am also an active participant in seeking passage of the Responsible Education About Life Act. I'm also very knowledgeable in the area of adolescent pregnancies, given my extensive research. The goal of the Responsible Education About Life Act is to provide for the reduction of adolescent pregnancy, HIV rates, and other sexually transmitted diseases. The number of teenage pregnancies has declined, but despite the decline, considerable disparities continue in teen birth rates, and the teen pregnancies continue to carry a great amount of social and economic costs. There is strong evidence that more comprehensive sex education can effectively help young people delay sexual initiation, even as it increases contraceptive use among sexually active youth. The decline in the teen birth rate between 1991 and 2004 resulted in saving taxpayers $6.7 billion in associated health care, child welfare, and other such costs. Many have argued that sex education is the responsibility of the child's parent and/or guardian, not the school system. Others say children are exposed to sexually related material from outside sources, some of which may have a far more negative effect than positive. Teen pregnancy rates are much higher in the United States than in many other developed countries. Ethnic and racial minority groups have been disproportionately affected by early pregnancy and parenthood. 53% of Latina teens and 51% of African American young women will become pregnant before the age of 20, as compared to only 19% of non-Hispanic white young women. The United States has one of the highest rates of sexually transmitted diseases among industrialized nations. There are approximately 19 million new cases of sexually transmitted diseases each year. Almost half of them occurring in young people ages 15 to 24. Since 1981, the United States government has been funding abstinence-only programs. These programs are primarily designed to teach students that the safest way to prevent an unwanted pregnancy and a sexually transmitted disease was to remain abstinent until marriage. The United States government has invested more than $1.5 billion since 1997 on abstinence-only programs in public schools, which have not yielded much success. Abstinence-only programs have been known to censor and exclude vital information from adolescents, which could possibly help them in making conscious decisions about their sex lives. Most Americans believe that sex education should promote abstinence and provide information about the effectiveness and benefits of contraception. A study conducted by the National Public Radio found that more than 90% of parents support sexuality education in schools. The study found that sex education programs have been helpful or somewhat helpful to the child in dealing with sexual issues. The comprehensive sex education stresses the value of abstinence while not ignoring those young people who have had or are having sexual intercourse. The comprehensive sex education provides information about the health benefits and side effects of all contraceptive and barriers methods used as a means to prevent pregnancy and to reduce the risk of contracting sexually transmitted diseases, including HIV or AIDS. It also encourages family communication between parent and child about sexuality. In conclusion, investing in effective programs that improve teen sexual behavior by delaying sexual activity, improving contraceptive use among teens, and reducing teen pregnancies would contribute to reducing the taxpayers' costs associated with teen childbearing. Thank you for your time and consideration.